Welcome to the GNP Sir channel. Based on our deep analysis of past papers of many states, we are discussing the topics of high importance that are frequently asked in Veterinary Officer, Veterinary Assistant Surgeon exams across the country. Watch the lecture completely and learn and memorize with us. Our today's topic is nerve supply and brachial plexus. Overview of peripheral nervous system. The peripheral nervous system consists of cranial and spinal nerves. Brachial plexus, major source of forelimb innervation. Derived from ventral branches of spinal nerves C6-T2. The brachial plexus is formed by ventral rami of C6, C7, C8, T1, T2 often contributes. Interlacing network before branching into terminal nerves. Located medial to scapula near first rib. The major nerves of brachial plexus include suprascapular nerve, supplies supraspinatus and infraspinatus. Subscapular nerve, to subscapularis muscle. Axillary nerve, to deltoideus, teres major, minor. Radial nerve, to extensors of elbow, carpus, digits. Median and ulnar nerves, to flexors of carpus, digits. Musculocutaneous, to biceps brachii, brachialis. Remember this table to memorize all nerves, their functions, and muscles supplied. The sensory distribution: radial nerve, dorsolateral limb skin. Ulnar nerve, caudomedial antebrachium. Musculocutaneous, medial forelimb. Axillary, lateral shoulder. Here are the species differences in the brachial plexus. Horse, median and ulnar nerves often fused. Dog, median nerve larger than in ox. Ox, well-defined cutaneous branches from musculocutaneous. Clinical relevance: radial nerve paralysis, common in large animals, e.g., pressure injury in lateral recumbency. Signs: dropped elbow, knuckling of fetlock. Treatment: anti-inflammatories, padded splints, time. Other brachial plexus injuries include suprascapular nerve injury, right pointing arrow, Sweeney shoulder, atrophy of supraspinatus, infraspinatus. Brachial plexus avulsion, complete flaccid limb paralysis. Important in downer cows, foals post dystocia. Use this table to memorize the key hindlimb nerves, their function, and the muscles supplied. The above summary table explains the forelimb and hindlimb nerve supply and their major actions. Memorize it to answer MCQs. Here is a quick MCQ recap. Important points. Brachial plexus formed from C6 to T2. Radial nerve equals extensors, ulnar equals flexors. Sweeney equals suprascapular injury. Knuckling, dropped elbow equals radial nerve paralysis. Kindly like, comment, share and subscribe to GNP Sir channel at YouTube.